Every day, technology enables us to communicate better, compute faster, and dream bigger. In healthcare, it's changing everything from the way we monitor chronic conditions and track our health to how we interact with doctors and treat disease. But even though an unprecedented number of technological tools now empower us to push the boundaries of what's possible, too few of them take aim at the most basic health needs of the country's most vulnerable populations. The more than 60 million low-income Americans on Medicaid are more likely to struggle with chronic conditions like diabetes and asthma, and they're less likely to seek preventable care, resulting in acute illness, urgent hospital admissions, and poor health outcomes, all while costing tens of billions of dollars each year. That's why Startup Health and the Robert Wood Johnson Foundation are calling on all entrepreneurs who want to make an impact in health to start building solutions for these communities, and to see the country's most vulnerable populations as a viable market.
Technology is at a place where it can provide a service and provide a tool for patients and families to use to improve their health outcomes. There are elderly who are underserved, there's rural populations that are underserved, there are racial and ethnic minority populations that are underserved. And when we think about it in terms of health, we think about it as a population that is not having their optimal health outcome.
It's a big system and it's integrated, and you can't ignore one whole chunk of the population and think that that's going to make everything better.
The biggest misconception is they don't care about their health and that they won't make an investment and they're not willing to make change. But that's absolutely not true.
Entrepreneurs and their investors have been reluctant to target underserved populations because of their limited purchasing power and cultural barriers. But the growing need and the mounting financial burden, as well as the changes brought about by health reform, are making the opportunities for entrepreneurs greater than ever before.
So I think the true opportunity is to rethink the business models of healthcare, to rethink everything from pricing to how technologies are used, and to start thinking about them in terms of how people integrate these things into their daily lives.
One of the big challenges is lack of technology in the community, and so our product in terms of how it supports patients is all through text messages, which is great because almost everyone has a cell phone. However, it's a small part of this, but still very relevant. When you get people just to kind of learn about your product or opt into the service you're extending to them, typically everyone sends an email, and you get that with any product you sign up for. And like very few of the patients in this population even have emails. And so that right there is like an interesting barrier of how do you explain a service they're about to get if your only way to explain it to them is through a text message.
Entrepreneurs are starting to tackle these problems, and some are beginning to find success.
We created an early detection system for health decline using low-cost workers, and we were able to demonstrate we can actually reduce readmissions by 40%. We were able to have a return on investment of 257%. For a payer, that would basically translate into over $100 saved per member per month.
But we need even more talent and technology to build creative solutions.
Especially lower income people who are poor. They tend to have higher levels of these chronic conditions, higher levels of obesity, and they tend to cost more over time in terms of medical expenses. And so if you want to solve the big problems in health, and chronic conditions are an issue, and you want to reduce costs, kind of the trifecta, you can't help but focus on these communities.
There's a lot of kind of gadgets and things and high tech out there right now in healthcare with all the devices and whatnot. And when working with a group like this, it's not about the Fitbits or the kind of really cool novel ways to do something. It's about like, if I'm at the grocery store, what's like the best food for me to be getting, that stuff that we might know right off the bat but they're unaware of. It's about, how do you get someone who's depressed, in part maybe due to a predisposition to being depressed, but in part because kind of their life situation's in a really bad place. How do you get them out of bed in the morning to just go for a walk?
I am a part-time physician and a full-time entrepreneur. And the reason I do that is I love patient care, and I love the learning that happens from the patient care, and I love to help them directly. But in terms of scale, I can only get so much scale of improving health for populations by doing one vaccine at a time. There's a role for that. There's a role for treating one pneumonia at a time. What makes me tick is not impacting one patient at a time, but impacting thousands of patients at a time. Technology, and digital health technology in particular, allows for pervasive impact on many patients at one time.